I'm Dr. Karen Blitz-Shabbir. I am the director of the North Shore MS Care Center. Today we're going to talk about the newly diagnosed patient. My approach to the newly diagnosed patient, actually. What I like to do is to make sure at the first visit that they get a lot of information. Information about the causes of the disease and the treatment options, as well as natural history. I think that allows patients to fully understand their disease, know what the potential dangers are with their disease, and then to embrace therapy. It's very, very important with all the data that we have at hand that patients start therapy as soon as possible. And it's easier for patients to start therapy as soon as possible when they know the importance and the value of the therapy they're going to start. So once patients have decided to go on a treatment, we discuss the impact that treatment has on the disease. Then we discuss the potential side effects of that treatment. They also have to understand that when they come to me for follow-ups, not only are we going to monitor them very closely, but we need to have an open communication about the kinds of problems that they're having, even things that they might think are irrelevant to the disease, because oftentimes they are very relevant. I often ask multiple questions in a follow-up interview just to make sure that we've addressed all the possible symptoms that they can have and make sure that their well-being is managed as best as I can. If patients don't bring forward all of the information that they need, it's very difficult to treat them adequately. For the most part, newly diagnosed patients do very well on treatment. We are so much better than we used to be with regard to managing side effects of the multiple medicines that we have and to making sure that their quality of life is excellent. I am a very strong proponent of exercise, almost to the fact that I abuse my patients. I really impact on them the value of exercise and the importance of pursuing exercise from day one on. We also have a nurse practitioner who works with us in the MS Care Center, and she's very helpful looking at quality of life issues, managing side effects related to the disease-modifying therapies, and really making sure that all facets of their life are looked at on a routine basis. I think for the most part, newly diagnosed patients are my favorite patients. It's like a clean slate. They can be given lots of information to utilize, and then we go on from there. Oftentimes I tell my patients it's kind of like a marriage. This is long-term disease, and we're going to be meeting with each other routinely for years to come. I learn a lot about the patients learn a lot about me. It's 50% social, 50% medical, and I think that's what makes it easier for patients to come in every 3 months or every 4 months and make sure their follow-up is very close. And my patients are told that they can call, but I often find it best for patients to meet with their doctors in person, because I think you get more information from the patient and the patient gets more information from the doctor for follow-up.